Millions of people in Greater Brisbane are nearly at the end of this 3-day lockdown, and they'll find out in an hour if it'll be extended. It all hinges on the COVID numbers, which will be revealed at the same time. It appears if there are no unlinked cases found, there's a strong likelihood the restrictions will be substantially eased, but it's obviously all up in the air at the moment. We'll bring that media conference to you live here on the ABC News channel, so it's in an hour's time with Queensland Premier Anastasia Palaszczuk and no doubt the Chief Health Officer Dr Jeanette Young there. Now reporter Sally Eales joins us now from Brisbane. Sally, g'day. So how likely is it that the lockdown could actually be extended through Easter?
Well, there is a real possibility that it could be extended through Easter beyond the current 5 p.m. deadline today. And as you said, it all hinges on what the test results from yesterday, what they've revealed. Now, we have had confirmation that the Premier will give her update in less than an hour at 9 a.m. local time. So she and the Chief Health Officer are probably going through all of those figures right now and checking how many cases we have. We're hoping we have no new community cases, but there could be some new community cases, and we're hoping for a small amount of those, and also hoping that if there are some, that they are linked to the current clusters which exist, because if they're not, then there's another real problem. So we had encouraging signs yesterday. We only had 2 locally acquired cases of COVID, and both of those linked to one of those clusters. One of those was another of the nurses from the Princess Alexandra Hospital, which is basically where both of the clusters have come from. And the second person from yesterday was the housemate of this nurse. So we're just hoping that the figures will be kind enough again to us today. So far with those 2 clusters, there are 19 people who have contracted the infectious UK strain since about March the 12th. And of course, there are thousands of people who have been to the exposure sites. There are now more than 100 across Brisbane, Gold Coast, even up to Gladstone. So there's a real push for anyone who has been to those exposure sites to please go and get a test, because as many people that can be ruled out, then the better off we are.
Yeah. And Sally, officials have been really happy with the number of people who've gone in for testing. I think it was like 33,000 or something yesterday, huge numbers. What's the general feeling among people in Greater Brisbane?
That's right. There have been thousands of people, and I think yesterday was one of the highest ones that we've had throughout the entire pandemic of people going and getting tested. People during the lockdown have really been taking it very seriously. There have been long lines at those testing clinics. People who know that they've been somewhere or been close to somewhere have all been lining up to get it. People have been coming out with doing their exercise, but really maintaining a social distance. Most people are carrying or wearing their masks, and people are all trying to stay at home. We're all positive, we're hopeful, because a lot of people want to go on holidays, and a lot of the business operators too are really just keeping their fingers crossed. You know, if we have to push through another lockdown Easter, that'll be our second one. And I mean, this is a perfect time of the year for holidays and for tourist accommodation venues. So they're really, really hopeful that it won't be extended past today.
Yeah. Okay, Sally Eales reporting there in Brisbane. And so just repeating that, because it's a big media conference today, millions of people waiting to hear the result of this. Anastasia Palaszczuk stepping up for that Queensland COVID update in less than an hour's time at 9 o'clock local time there in Brisbane, 10 o'clock Australian Eastern Daylight Time. We'll bring that to you live here on the ABC News channel. There's been heartbreak and some anger over the last-minute cancellation of the big Byron Bay Blues Festival. The news came through late yesterday, called off because of the local COVID case there, who was sitting near a hens party from Queensland, which ended up having multiple cases at Byron Bay's Beach Hotel last Friday. And more venues are being listed as possible exposure sites for locals in the far north of New South Wales. Reporter Leah White joins us now from Byron Bay. Leah, g'day. So take us through restrictions that currently apply to the northern rivers.
Yeah, good morning, Joe. Well, as you mentioned, there's been a raft of new restrictions following the news that there had been a locally acquired case of COVID as a result of that hens party being down here for the weekend. So there was a man in his 20s who was at the Beach Hotel on Friday night, sitting close to those positive cases. He's since tested positive, and that's what's resulted in the new measures. Now, they include mandatory masks anywhere indoors unless it's a residential home. It includes removes limits on the amount of people you can have in your home and also in holiday homes. So that's capped at 30 at the moment, unless you've got a family that's larger than that. They've also reintroduced the 1 person per 4 square metre rule for retail outlets, restaurants and the likes, and that's a 2 metre per person square rule for outside of those venues. And of course, they're just reiterating the safety messages and for everyone to monitor those close contact venue sites and stay on top of the health messages. And there has been some, pleas with people in the Ballina, Byron, Lismore and Tweed LGAs to which these restrictions apply to stay within those areas if they can, and perhaps suggesting if people can reconsider their plans to travel to these areas to perhaps do so.
Leah, what have you noticed about the number of people on the streets there this morning and out and about?
Well, Joe, as you can see, the weather's not too inviting. It's probably reflecting how we're all feeling here at the moment, a little glum and just hoping that it passes soon. There hasn't been too many people here today and yesterday just with the weather. So I guess in terms of, you might be able to see the surf club behind me, that's been turned into a pop-up COVID site. Now the lines have fluctuated. The first day after the news of the COVID case, there were very long lines of people getting tested. It's dropped off a bit now, particularly with the torrential rain that's been on and off this morning, but it is a bit quieter. At night, though, we have seen places like the Beach Hotel be extremely busy, despite the fact that that was a location where there were confirmed COVID cases.
And Leah, tell us about Bluesfest. First of all, describe how big an event this is for that area, and then what's been the reaction to the cancellation and how the news of the cancellation came through.
Yeah, certainly. So Bluesfest is the biggest festival on the Northern Rivers. It's a 5-day music festival. This year they were planning to operate at half the capacity they normally would, but in saying that, they were still expecting between, I think, 9,500 to 16,500 people there each day. Of course, in the wake of this new locally acquired case of COVID, they got the news yesterday, less than 24 hours before the gates were expected to open, that they did have to cancel. It's a huge event for this part of Australia, and certainly it's had a huge flow-on effect, not just for the musicians. They've done it extremely tough for the last 12 months, and this was kind of touted as a return to some kind of normalcy. And it also has huge implications for all the stall holders there, so it's thousands of dollars for them and months of preparation. But we spoke to the Byron Mayor, Simon Richardson, a short while ago, and he spoke a bit about the economic impact of all of this.
The ripple effect is massive. It's not just the economic activity on the site or even people coming to the site and staying in town. It's the fact that when money goes into that particular shop, or that florist that might put the plants in for the VIP space, they then have some more money that they then get their back deck fixed, and then the local chippy gets work as well. So when money comes in, it flushes, I guess, through the wider ecosystem of our community. And so it's going to be felt significantly.
Yeah, so as Simon mentioned then, it is going to have a huge economic impact, but I think there is some understanding among the community here of the health ramifications if that event did go ahead. I mean, one case with potentially 16,500 people at that event, even with the measures they were taking, we're talking about a highly contagious strain of COVID. So it is mixed feelings up here on the North Coast, and I think everyone will just be waiting and watching the latest news to come out of the press conferences today.
Reporting there from Byron Bay. And so a lot of anticipation about those media conferences in Queensland and New South Wales. As I've been mentioning, the Queensland media conference coming up in about 50 minutes' time. We haven't yet got a time for the New South Wales media conference. It's usually held around 11:30 New South Wales time. So we'll be looking out for that through the day and bring that to you live here on the ABC News channel as well. Victorian authorities are urging anyone with COVID symptoms in 18 Melbourne suburbs to get a test after fragments of the virus were detected in wastewater. Reporter Stephen Schubert joins us now from Melbourne. Stephen, g'day. So where have these fragments of the virus been found?
G'day, Joe. There are 4 suburbs in Melbourne's west and 14 suburbs in the southeast where fragments of COVID-19 have shown up in wastewater. It is a fairly blunt tool, this wastewater testing, because it's Unclear whether these are people who are undiagnosed living with COVID-19 in the community, or whether they're perhaps people who have had the virus and recovered but are still shedding some of it, because the test can pick that up too. So health authorities really can only ask people to get tested if they have been living in these suburbs or if they visited these suburbs in the last week or so, and if they're showing any symptoms of COVID-19, authorities are pleading with people to go and get a test. There is some good news though in Victoria, Joe. We've extended our run of no new virus days to 35, so that is some positive news coming out of Victoria today.
And how are the clusters in New South Wales and Queensland affecting Victoria?
Well, of course, Victorians want to guard their coronavirus-free status very carefully. So there are currently 20 people in quarantine who have been in contact with hotspots in Queensland and New South Wales. The good news is that 16 of those people have had negative coronavirus results come back. We're waiting for the last 4 results for people. But so anyone coming from those hotspots into Victoria is required to quarantine for 14 days, Joe.
Okay, Stephen Schubert reporting there from Melbourne. Doubts are being cast on the federal government's capacity to meet its October vaccine deadline unless the states and territories are given a greater role. New South Wales Premier Gladys Berejiklian says the Commonwealth has to work better with the states or the rollout won't work. It comes after a blame game erupted between the federal government and the states over the pace of the rollout. Political reporter Tom Lowry joins us now from Parliament House in Canberra. Tom, g'day. So what's got the New South Wales Premier worried?
Yeah, Gladys Berejiklian says that the way she sees it, that October deadline simply won't be met under the current plans. Now, the deadline is that all Australians who want access to a COVID-19 vaccine will be able to get one by the end of October. The background to this is basically that the states are furious with the federal government over some numbers that were published in the News Corp tabloids yesterday. Those numbers outline the difference between the number of vaccines that have been delivered to the states and the number of vaccine doses that have actually been administered by the states. And in some cases, according to those figures, the gap there can really be quite large, as much as 50%. Now, some federal government ministers came out this morning and said that the states are asleep at the wheel here, that they've been deliberately slowing down the vaccine rollout and stocking up on vaccine supplies because of concerns about the supply of vaccine doses coming from the Commonwealth. And those ministers said those concerns are completely unnecessary. The states say those numbers are misleading and they're pretty furious they were released at all. The New South Wales Premier Gladys Berejiklian came out again this morning and said that she's disappointed those numbers were made public. She says the states are doing a very good job, and she says unless the states are actually given more responsibility for the vaccine rollout as the rollout continues, that October deadline, which is a key target set by the Prime Minister, can't be met.
Once we finish our 300,000 that we've been allocated, we're saying we've got 100 hubs across the state. We've got clinicians, we've got nurses to complement and support the GP network to make sure there's a hope in reaching the October deadline. Because if the state government doesn't step up and help the Commonwealth, we will not reach the October deadline. I can tell you now, it just doesn't stack up.
And so, Tom, yesterday we had the situation where there were some federal government ministers speaking in the morning saying some really pointed things with criticisms about the states, and then the Prime Minister stepping up later and saying, oh, no, I don't want to play politics at all. But you're saying again that some federal ministers have got up this morning saying that states are asleep at the wheel?
Yeah, well, no, so not quite the case, but the Prime Minister, obviously, as you mentioned, came out yesterday and tried to cool things down. He and the Federal Health Minister, Greg Hunt, are the people most responsible for the vaccine rollout and doing most of the work and liaising with the states on the rollout. They've had a very different message since those ministers came out yesterday morning and made those really pointed comments. The Prime Minister trying to cool things down, saying, no, the Commonwealth and the states are working quite well together. Greg Hunt was, quite gushing in his praise for the states yesterday afternoon. He's been out again this morning saying much the same thing, that the states are doing a good job on the vaccine rollout, and he's responded to that idea from Gladys Berejiklian that the states could have a greater role down the track, saying he does see some merit in it.
They're frankly doing a very good job. We're pleased that many of them would like to now expand their role, given the available doses and the fact that they have large numbers of reliable doses which have been pre-positioned, which gives them the opportunity to expand into the 1B category of the over 80s and the over 70s. It'll be a matter for each of them. But the truth of it is, Australians are being vaccinated. At the same time, 590,000 cases around the world, 3 in the community in Australia yesterday of concern, but we know how to do this.
Now, the government maintains that the pace of the rollout is slowly starting to pick up, that things are really on track. Mr. Hunt has said that he'd like to see 750,000 doses of the vaccine administered by the end of today, somewhere around that number. The Prime Minister says he wants to see the 1 million figure hit sometime next week. So we'll see if those targets are met.
Okay, Tom Lowry there in Canberra.